Okay, have you ever noticed your finger getting kind of stuck? Or maybe felt a painful click when you try to straighten it, especially, first thing in the morning?
Yeah, that feeling. It can be really disruptive.
Exactly. Well, today we're taking a deep dive into trigger finger. It's a condition that can really mess with how well you use your hands. We'll unpack what it is, what causes it, how doctors figure it out.
And crucially, the different ways you can get some relief.
Right.
And for this discussion, we're drawing on some really valuable insights, especially from Dr. Roshan Kanal. He's a senior MSK practitioner and sport and exercise scientist over in the UK, working in both primary and secondary care settings. Lots of experience there.
Good stuff.
Yeah.
So, okay, the core issue with trigger finger is basically that you can't smoothly bend or straighten your finger or thumb. It just sort of
Yeah.
catches.
Exactly. It gets stuck. And it's interesting to look at why that happens, the anatomy behind it. The main player here is usually something called the A1 pulley. Now, think of the tendons that bend your fingers, your flexor tendons, like lines running through guides.
Okay.
The A1 pulley is one of those guides, a really important one. Right near the opening of the tunnel, the tendon runs through. Down at the base of the finger in your palm, it holds that tendon close to the bone.
So it keeps the tendon in line. But what makes it go wrong? Why does it start triggering?
Well, the current thinking is that it's often caused by repetitive movements, maybe forceful finger use. That constant friction can lead to inflammation.
Ah, inflammation, so the pulley gets inflamed.
Right, and that makes the tunnel narrower. The pulley itself might thicken, making it harder for the tendon, which sometimes develops a little nodule on it too, to glide through smoothly. It's like a bottleneck.
Okay, that makes sense. Are some people more likely to get this?
Yes, there are definitely risk factors. Having diabetes mellitus is a big one. It might be related to how glucose affects collagen in the body.
Mm.
Also things like carpal tunnel syndrome, Dupuytren's disease, that condition that makes your fingers bend inwards, or even rheumatoid arthritis can increase your risk.
So what would you actually feel if you had this? What are the symptoms?
Well, pain and tenderness is common, usually right at the base of the affected finger or thumb in the palm area where that A1 pulley is.
Right where it's catching.
Exactly. And then there's the main event, that clicking or locking sensation when you move the digit. It's often, as you said, much worse in the morning.
That morning stiffness, yeah.
And stiffness overall can be a problem, especially with trigger thumb. Sometimes it gets so locked that you literally have to use your other hand to gently straighten the finger out.
Wow. So how does a doctor confirm it's trigger finger?
It's usually a pretty straightforward clinical diagnosis.
Hmm.
We'd feel for tenderness over that A1 pulley area, maybe feel for a little lump or nodule on the tendon.
Okay.
And then a simple test, just asking you to open and close